Hello, my name is Karen Fife, and today I'm going to be talking about postpartum hemorrhage, also known as PPH. So, postpartum hemorrhage is known as loss of blood greater than 500 milliliters after a vaginal delivery and loss of blood greater than 1,000 milliliters after a cesarean section. So, postpartum hemorrhage is the leading cause of maternal death. It's the most preventable cause of maternal death. Women who are 20 weeks gestation and beyond are at greater risk. This is a chart of the global estimates of the cause of maternal death. You can see here that hemorrhaging is the leading cause at 35%. So estimated blood loss during delivery is typically inaccurate. The amount of blood loss is often underestimated by the delivering physicians. PPH occurs in the third stage of labor. This is between delivery of the child and delivery of the placenta. Risk factors. PPH most commonly occurs when the uterus fails to contract after delivery. This is known as uterine atony. There is a greater risk for PPH to occur if there is a past history of PPH noted in the patient. Pregnancy complications including placenta previa and erupto placenta, and any trauma experienced during the delivery or the pregnancy. Signs and symptoms: uterine atony. This is when the uterus fails to contract after delivery, blood clots greater than the size of a quarter, and any perineal pads saturated within 15 minutes. Complications include hypovolemic shock and anemia. Hypovolemic shock, the signs and symptoms include tachycardia, hypotension, cold and clammy skin, oliguria, which is decreased urine production. This can be defined as less than 30 milliliters of urine per hour. And anemia is low hemoglobin and hematocrit levels. Nursing diagnosis. This is one example of a nursing diagnosis for PPH. Deficient blood volume related to excessive blood loss as evidenced by decreased blood pressure and increased heart rate. This is a plan. You want to assess amount and site of bleeding, assess the uterus and massage if boggy, measure intake and output, administer medications as ordered. So these are some nursing interventions. As a nurse, you would want to monitor vital signs, assess for bleeding. You would want to assess the fundal height, firmness, and position. Massage the uterus if you determine that it's boggy. Assess for bladder distension. Insert an indwelling urinary catheter as ordered and obtain accurate measure of output. Maintain or initiate IV fluids. This includes lactating ringers or blood products. So prevention, PPH can be prevented with administration of oxytocin. This will be a bolus immediately following delivery. Early umbilical cord clamping. You want to assess and massage the fundus after delivery as necessary. So within the first hour, you want to assess every 15 minutes. In the second hour, you want to assess every 30 minutes. And after that, it will be hourly. These are some medications. Oxytocin, also known as Pitocin, is a uterine stimulant. It promotes uterine contractions. With this medication, you want to monitor for water intoxication. This includes nausea, vomiting, headache, and lightheadedness. And Methergin, this is also a uterine stimulant. It helps control postpartum hemorrhage. Contraindications of this medication are hypertension. With this medication, you want to assess uterine tone and vaginal bleeding, and adverse effects include hypertension, nausea, vomiting, and headache. These are some treatments if PPH is noted. Packed red blood cells. If consent is previously received, 2 RNs must verify the blood type before administration. And surgery if it is absolutely necessary. This is a last resort for PPH. Recognition, immediate recognition is absolutely necessary in order to treat the underlying cause of PPH. Evaluation, you want to assess return of baseline vital signs, hemoglobin and hematocrit within normal limits. The normal limit of hemoglobin is 12 to 15 and hematocrit is 35 to 52. You want to assess for normal bleeding for postpartum delivery. Client education, so you want to instruct the client to limit physical activity and conserve strength. Increase iron and protein intake to promote red blood cell volume. These are my references that I used for this presentation. Copyright material was probably acknowledged. Thank you for your time.